Hi, my name is Caitlin and I'll be walking you through my specimen collection video. First, I would perform hand hygiene and don gloves when collecting any kind of specimen. Okay, the first specimen collection I'm going to go through is a urine specimen. We have two different kinds, a UA, which is a regular urinalysis, which doesn't need to be sterile, and then we also have a the midstream urine specimen catch, which has to be sterile. It comes in a little kit. So the first one, we would get the specimen into a cup and take one of these little dipsticks that's in here. They're called Regent strips. Dip it into the urine and let it sit for the desired amount of time. Next to the bottle shows the normal values. Anything abnormal you'd be able to identify on the side. The next one we have is the culture and sensitivity one, where they would have to grow to see which kind of bacteria it is. We would instruct the patient to use the little cleaners, wipe from front to back, or if it was a male, to clean the meatus of the penis, and start urinating, stop the stream, urinate again, and collect the specimen in the cup. The specimen would then be capped and labeled, and if it wasn't sent off right away, we would have to store it in the refrigerator if it was over an hour. The next, also, if you were to get the specimen from a Foley catheter, we would do the same thing. We would scrub the hub for at least 30 seconds, the port, take our syringe and needle, extract 30 to 120 milliliters. Before you do that, you would never want to get it from the bottom of the bag. You'd always want to clamp this off, that way you've got a clean stream of urine. Clamp this off, make sure it collects in the tube, and then you would be able to extract the 30 to 120 milliliters. You would take your collection into a cup, cap it, send it off, or place it in the refrigerator if it's over an hour. The next collection that we have would be a feces collection. It's a colon screen. We would collect the feces, scoop up a little bit of it. We have these little screening kits. Smear some on A, scoop some more up with the other side of the stick, smearing it on B. Close it, flip it, lift this up, and pour a few drops on either side with the developer that comes along with it. And any blue that shows up would indicate blood in the stool, and the person would most likely have to go for a colonoscopy to determine why there was blood in the stool. Could be hemorrhoids, colon cancer. The next specimen that we have is a sputum specimen. So what you would do is you would sit the patient up as much as they could bear, have them take a few deep breaths, and then place the cup near their mouth and have them cough as hard as they can, trying to collect as much of the sputum as possible. You want to cap it, send it off, and make sure when you're also sending anything off to the lab or you're collecting anything, you want to immediately label all of it with the patient's information, time, date, your information. And then the last one that we have is a culture swab. This is, you could either do a rapid strep test, you could test for the flu and for MRSA. So the strep test, what you would do is you would take this out of the container, you would swab the back of the throat, making sure not to touch any of the cheek or gum area. You want to touch just the inflamed area or the white pus bubbles that are in the back of the throat. Cap it immediately, label it, send it off. And then they also have the MRSA and the flu one. You would take it out of the container. Most of the time they come with two for the flu and the MRSA, and you would stick one of the long Q-tips up either side of the nostril, making sure to get nice and back there as far as you can. Swab, cap it, label it, and send it off. And that concludes my video. Thank you.